As a senior driver in Ontario, why is it recommended to avoid driving immediately after taking certain prescribed medications? A. They may cause drowsiness or delayed reaction time. B. They improve alertness but reduce vision. C. They reduce blood pressure instantly. D. They increase hand strength but reduce grip control. Answer: A. Many medications, especially for seniors, can cause drowsiness, dizziness, or slower reaction times, which can significantly affect driving safety. It is important to understand side effects before driving. During the Ontario Senior Driver Renewal process, one requirement is A. A mandatory written essay. B. A group road trip assessment. C. A vision test and knowledge review. D. A full driving course retake. Answer: C. Seniors in Ontario, 80+, must complete a vision test and a short knowledge review to ensure safe driving ability, not a full road test unless flagged for further review. If a senior driver feels glare from oncoming headlights at night, the safest action is to A. Close their eyes briefly until lights pass. B. Look slightly to the right edge of the road. C. Speed up to pass the glare quickly. D. Flash high beams back at the driver. Answer: B. Looking to the right edge of the road helps maintain lane position, while reducing the temporary blindness from oncoming headlight glare. Which factor most commonly affects senior drivers during winter driving in Ontario? A. Reduced sense of hearing. B. Stronger grip on the steering wheel. C. Longer reaction times combined with slippery roads. D. Better tolerance to cold weather. Answer: C. Seniors often experience slower reaction times, which can be risky on icy or snowy roads where quick responses are critical. A senior driver should schedule their road trips at times when A. Traffic is light and visibility is good. B. Rush hour is at its peak. C. Late at night for fewer distractions. D. Weather warnings are issued. Answer: A. Planning trips during daylight and non-peak hours ensures better visibility, reduced stress, and fewer hazards, which supports senior driver safety. If a senior driver experiences difficulty turning their head fully to shoulder check, they should A. Avoid lane changes altogether. B. Use larger mirrors or install blind spot mirrors. C. Drive only in the left lane. D. Ignore blind spots and rely on signals. Answer: B. Seniors with reduced neck mobility can improve safety by using larger mirrors or blind spot mirrors to compensate for limited head movement. Ontario law requires that senior drivers renew their license every A. 2 years after age 65. B. 5 years after age 80. C. 2 years after age 80. D. Annually after age 70. Answer: C. In Ontario, once a driver turns 80, license renewal is required every 2 years, including tests to ensure safety on the road. When a senior driver hears emergency sirens but cannot determine the direction, the safest step is to A. Stop immediately in the middle of the lane. B. Pull over safely to the right and wait. C. Speed up to clear the area. D. Ignore unless the vehicle is visible. Answer: B. If unsure where the siren is coming from, the safest option is to pull over to the right until the emergency vehicle passes. Why should senior drivers keep a longer following distance? A. To reduce stress on car brakes. B. To allow more time for reaction. C. To avoid speeding tickets. D. To save fuel in traffic. Answer: B. A longer following distance provides extra time to react, especially important for seniors who may experience slower response times. If a senior driver wears hearing aids, they should A. Turn them off to avoid distraction. B. Keep them on and properly adjusted while driving. C. Remove them when traffic is light. D. Only wear them at night. Answer: B. Hearing aids should always be used while driving so seniors can hear sirens, horns, and environmental sounds clearly. What is the biggest risk of night driving for seniors? A. Overheating the vehicle. B. Reduced glare resistance and poor contrast sensitivity. C. Faster reaction time. D. Easier navigation. Answer, B. Seniors often struggle with glare and low contrast at night, making hazards harder to detect and increasing risks. If a senior driver experiences sudden dizziness while driving, they should A. Continue driving until symptoms pass. B. Pull over safely and stop immediately. C. Open windows for fresh air while still driving. D. Drive slower without stopping. Answer, B. Stopping safely at the roadside is the correct response to sudden dizziness, preventing possible accidents. Ontario's Senior Driver Program aims to A. Remove older drivers from roads. B. Support safe driving and independence. C. Increase license fees for seniors. D. Require seniors to retake full road tests annually. Answer, B. The program is designed to balance road safety with maintaining independence for seniors by assessing ability, not age. A senior driver who struggles with quick left turns at busy intersections should A. Avoid left turns by planning routes with right turns. B. Turn without stopping. C. Rely only on other drivers yielding. D. Close their eyes and go quickly. Answer, A. Route planning with right turns instead of left reduces exposure to high-risk intersections and improves safety. A senior who notices delayed reaction when braking should A. Drive closer to the car ahead. B. Increase following distance and brake earlier. C. Avoid using the brake pedal often. D. Drive only in bad weather. Answer, B. Adjusting driving habits, like braking earlier and keeping more distance, compensates for delayed reaction times. If bright sunlight makes it hard for a senior to see traffic lights, they should A. Wear polarized sunglasses and use the visor. B. Drive faster to pass the lights quickly. C. Ignore signals and follow other cars. D. Stop until the sun sets. Answer, A. Sunglasses and visors reduce glare and make traffic signals clearer, improving safe decision-making. Which physical condition most affects a senior's ability to check blind spots? A. Arthritis or reduced neck flexibility. B. Improved peripheral vision. C. Stronger hearing abilities. D. Faster reflexes. Answer, A. Arthritis and reduced flexibility limit head turning, making it harder to shoulder check blind spots effectively. Why is lane discipline especially important for senior drivers on highways? A. To test their reflexes. B. To avoid drifting due to reduced focus or fatigue. C. To increase driving speed. D. To use GPS navigation. Answer, B. Maintaining correct lane position reduces the chance of drifting, a risk for seniors who may experience fatigue or slower responses. Ontario requires seniors to pass a vision test because A. Night vision and depth perception decline with age. B. It increases insurance coverage. C. It prevents seniors from wearing glasses. D. It lowers license renewal costs. Answer, A. Vision naturally declines with age, and tests ensure seniors can still meet safe driving standards. If a senior driver feels overwhelmed by traffic complexity, the best decision is to A. Stop in the lane and wait. B. Exit traffic safely and take a break. C. Speed up to get through faster. D. Follow the car ahead blindly. Answer, B. Pulling off the road safely and taking a break reduces stress and prevents mistakes from overwhelming situations. A senior driver is approaching a pedestrian crosswalk in Ontario where pedestrians are waiting. What must they do? A. Slow down but continue through. B. Stop and allow pedestrians to cross fully. C. Flash headlights to signal pedestrians. D. Honk to alert pedestrians to hurry. Answer, B. Ontario law requires drivers to stop and let pedestrians completely cross at designated crosswalks. Seniors should take extra care due to slower reaction times. When driving on a snowy road, seniors should A. Use sudden steering to control skids. B. Maintain steady speed and gentle movements. C. Drive without headlights for better vision. D. Brake sharply to stop quickly. Answer, B. Gentle steering, braking, and acceleration help maintain control on snow. Seniors must plan ahead due to longer stopping distances. A senior driver feels nervous driving on busy highways. A recommended strategy is: A. Stay only in the passing lane. B. Use service roads or alternate routes. C. Follow trucks closely for guidance. D. Drive during peak hours for practice. Answer, B. Choosing quieter routes reduces stress and risk, making driving more comfortable and safer for seniors. What is the safest way for a senior driver to handle fatigue during a long trip? A. Drink excessive coffee and keep driving. B. Take regular rest breaks every 1 to 2 hours. C. Drive faster to finish sooner. D. Roll down windows instead of resting. Answer, B. Frequent breaks prevent fatigue, which can cause slower reflexes, drowsiness, and poor judgment, especially for seniors. Ontario seniors are encouraged to limit night driving because: A. Traffic lights turn off at night. B. Their insurance is void after dark. C. Glare and reduced night vision increase crash risk. D. Roads close for seniors at night. Answer, C. Seniors may struggle with glare and poor night vision, so limiting night driving lowers risk and improves safety. Which driving practice reduces stress for seniors at four-way stops? A. Waiting until all other cars leave first. B. Understanding and following right-of-way rules. C. Driving through without stopping. D. Avoiding stop signs altogether. Answer, B. Right-of-way knowledge gives confidence and prevents confusion at four-way stops, where hesitation can cause accidents. If a senior driver is unsure of the speed limit in an Ontario urban area, the default legal limit is: A. 40 km per hour. B. 50 km per hour. C. 60 km per hour. D. 70 km per hour. Answer, B. Unless posted otherwise, the default speed limit in Ontario cities, towns, and villages is 50 km per hour. Seniors who experience slower reaction times should especially avoid: A. Following cars too closely. B. Driving at steady speeds. C. Using turn signals early. D. Checking mirrors often. Answer, A. Tailgating leaves little reaction time, which is especially dangerous for seniors with slower reflexes. A senior driver notices confusion at large roundabouts. What is the correct action? A. Enter without yielding. B. Yield to traffic already inside the roundabout. C. Stop in the middle of the roundabout. D. Drive in the opposite direction. Answer, B. Ontario rules require yielding to vehicles already circulating. This prevents collisions and keeps traffic flowing smoothly. Which factor makes winter driving particularly challenging for Ontario seniors? A. Reduced daylight hours and icy conditions. B. Warmer weather reducing focus. C. Empty roads causing overconfidence. D. Snow reducing the need for seatbelts. Answer, A. Shorter days and icy roads combine to increase risks, especially when vision and reflexes are reduced with age. What is the safest way for a senior driver to merge onto a busy Ontario highway? A. Enter slowly without matching traffic speed. B. Accelerate in the merging lane to match traffic flow. C. Stop completely before merging. D. Merge without signaling to avoid distraction. Answer, B. Matching speed ensures smooth merging. Seniors should plan early, signal, and adjust safely to traffic flow. Ontario law requires headlights to be used. A. Only during winter. B. 30 minutes before sunset until 30 minutes after sunrise. C. Only if the driver feels it's necessary. D. Only when speed exceeds 80 km per hour. Answer, B. Headlights must be used during low light conditions for visibility. Seniors benefit from using headlights earlier for safety. If a senior driver struggles with multitasking, such as adjusting GPS while driving, the safest solution is to A. Adjust GPS only when stopped safely. B. Hold GPS in one hand while steering. C. Ask nearby drivers for directions mid-drive. D. Ignore all navigation aids. Answer: A. Seniors should avoid distractions. Stopping safely to adjust devices ensures attention remains on the road. Which maneuver is particularly risky for seniors with slower reaction times? A. Backing out of busy parking lots. B. Driving in a straight rural road. C. Using cruise control on highways. D. Parking in designated spaces. Answer: A. Parking lots require quick reactions to pedestrians and cars. Seniors must move slowly and check surroundings carefully. Why should seniors maintain proper hydration during driving? A. Dehydration may cause dizziness or confusion. B. It reduces fuel consumption. C. It prevents tire blowouts. D. It increases vehicle mileage. Answer: A. Seniors are more prone to dehydration, which can cause lightheadedness and poor concentration, increasing crash risk. What is the best lane position for a senior driver on a multi-lane highway who prefers steady speeds? A. Left lane for faster traffic. B. Middle or right lane for consistent flow. C. Weaving between lanes for flexibility. D. Shoulder of the road for safety. Answer: B. Staying in the middle or right lane allows steady, predictable driving, avoiding high-speed stress of the passing lane. Ontario seniors are required to complete a group education session during renewal primarily to A. Increase government revenue. B. Review safe driving practices and recent law changes. C. Test their ability to drive long distances. D. Compare driving skills with younger drivers. Answer: B. Education sessions refresh seniors on safe practices, laws, and updates that help maintain driving safety. If a senior driver cannot see the traffic light clearly due to bright sunlight, the safest action is A. Slow down and look at surrounding traffic cues cautiously. B. Drive faster to pass the intersection. C. Ignore the signal until clearer. D. Honk and proceed. Answer: A. Slowing down allows more time to confirm the signal safely and reduces crash risk due to misjudgment. Seniors are advised to check their mirrors more frequently because A. Their side vision may be reduced with age. B. It is required only for trucks. C. It avoids the need for signals. D. It reduces gas consumption. Answer: A. With reduced peripheral vision, seniors benefit from frequent mirror checks to stay aware of traffic around them. If a senior driver feels anxious about driving in heavy rain, the safest choice is A. Avoid driving until weather improves. B. Drive without wipers for focus. C. Increase speed to pass the storm. D. Ignore weather conditions and continue. Answer: A. Choosing not to drive in unsafe conditions like heavy rain prevents accidents, especially for seniors with slower responses and reduced vision.